Hi everyone! For this week's Healthcare in the News, we'll be focusing on an article from Kaiser Health News titled Lack of Antigen Test Reporting Leaves Country Blind to the Pandemic. Published on September 16, 2020, this article focuses on how the lack of antigen test reporting can be very dangerous and creates a barrier to be able to effectively model and project the epidemic in the United States. Why do we need antigen tests for COVID-19? Antigen tests are immunoassays that detect the presence of a specific viral antigen, which implies current viral infection. Antigen tests are relatively inexpensive and can be used at the point of care. Results can show up within approximately 15 minutes. Rapid antigen tests can be used for testing in high-risk congregate settings like a university campus. Repetitive testing can quickly identify individuals with COVID-19 to inform infection prevention and control measures preventing transmission. Although antigen tests have a lower sensitivity than RT-PCR tests, there is value in providing immediate results in settings where a rapid turnaround time is required. More than 20 states don't release or have incomplete data on the rapid antigen test, which is now considered key in containing the coronavirus. With this missing information, it leaves officials and the public in the dark about the true scope of the pandemic, as cases are left uncounted. This becomes an issue especially when federal officials are prioritizing antigen tests over slower but more accurate PCR tests. Having only this patchy data on COVID testing to rely on carries enormous consequences as decisions for schools and businesses to reopen are made. If we go back to normal too quickly, it risks a greater number of outbreaks. If we keep people at home for too long, we risk an even greater economic crisis. Janet Hamilton, the executive director of the Council for State and Territorial Epidemiologists, states, "The absence of data is a very dangerous thing. We will be blind to the pandemic. It will be happening around us and we will have no data." This map here shows the states in red that do not report antigen test results or don't count antigen positives as COVID cases. 21 states as well as DC do not report all antigen test results. 15 states and DC do not count positive results from antigen tests as COVID cases. 2 states do not require antigen test providers to report results, and 5 other states require only positive results to be reported. Nearly half of states believe their antigen test results are underreported. The problem stems from the fact that many providers who would use antigen tests don't have an easy way to send data electronically to public health authorities. This leads to state counts of infected people being artificially low. The lack of public and uniform reporting could imply infection rates are declining because the virus isn't spreading as widely, when more antigen tests are just being used and not counted. There is sufficient testing to achieve all objectives in the testing strategy, including identifying newly emergent outbreaks, supporting public health isolation and contact tracing, protecting the vulnerable, supporting safe reopenings of schools and businesses, and enabling state testing plans. Before early August, the CDC defined a confirmed COVID case as one that is determined from a PCR test, and positive results from antigen tests are considered probable cases because the test can be less accurate. Positive antigen tests are now considered real cases in the same way a PCR test is a real case. Many universities and nursing homes are using antigen tests as opposed to PCR tests. At Indiana University, more than 14,000 tests were administered across 4 campuses. Each night, a university staff member would manually download the spreadsheet off each of the test machines and securely email it to the state health department. Some data is even being sent via fax. Staff members at a nursing home in Virginia Beach, Virginia, are taping pieces of paper together to deliver details of who has been tested and hoping local officials would accept it. We can see how this can get very disorganized very quickly. The problem is there is no universal system or technology platform to submit this information, resulting in inaccurate data when it comes to testing results. I have provided 2 questions to get the discussion started. First, the CARES Act, which Congress passed in March, requires healthcare providers to report any COVID test result to state or local health departments. Yet, various states are doing different things, like not reporting antigen test results or only reporting positive results. How could the CARES Act be updated in a way to create an accurate number of reported cases? Second, Northeastern uses the PCR test method, where test results are typically released within 36 to 48 hours. What would be the pros and cons if Northeastern were to switch and use rapid antigen test?